Did you know that 87% of Canadians are likely to be directly affected by major disease or chronic illness over the course of their lifetime? And did you know of those Canadians who will suffer from chronic disease, 25 to 50% of them will also experience some form of depression? And when you look at specific diseases, it gets even worse. For those living with diabetes who are also depressed, there's a 30% increased chance of mortality. For people who've experienced a heart attack, if they're depressed, they're 3 to 4 times more likely to die from heart disease than those who are not. It's a serious problem and one that affects us as Canadians in every community, in every household, in every workplace across the country. Did you know that the risk of depression is higher for those in workplaces than in the general population? And every single day in this country, 500,000 Canadians are absent from work because of depression. It could be because they're dealing with a loved one who has chronic disease or major illness, and caregivers are 20% more likely to be depressed than those who aren't looking after a loved one who's experiencing a major illness or chronic disease. 500,000 people every single day. We know that the lost cost in terms of productivity to the Canadian economy is $51 billion every year. But the cost to us as employers and as employees is profound, as people are absent for their work, maybe they're present at work, but not really able to contribute or being productive because of the worry about their own illness or the disease or illness of a loved one. And we also know that people who have a concurrent physical and mental illness are more likely to stay off work longer. That increases our insurance cost and our cost of disability. There is a real connection between physical illness and mental illness. At HealthPartners, we are a collaboration of 16 national charities. We're releasing a report on June 17th that actually looks at the link between physical and mental illness and what our 16 partners are doing to work with Canadians to eradicate that, to provide support, to provide programs to help Canadians in real need in every community, every single day. I'm Eileen Dooley. I'm the CEO of HealthPartners, and we are working with our partners to transform the health of Canadians in every community across this country. I hope you will check out our website, healthpartners.ca, or check out I Am Living Proof to see stories of how donations from individuals and workplaces in federal service, federal public service, in workplaces across the country are creating examples of living proof. Those who've had chronic disease, those who have mental illness, and those that are benefiting from the donations that you've provided. Thank you very much.